Hi students, in this video we are going to learn 6th biology chapter 5 respiratory system. In this chapter we are going to learn common respiratory diseases: asthma, bronchitis, pneumonia, tuberculosis. Okay, first one is the asthma. Okay, asthma is a respiratory disease caused due to allergy. Okay, allergy means in Tamil ovamai. The respiratory passage become swollen and constricted. Swollen means weaken, constricted, surukam. The respiratory tube become swollen and constricted. Next, symptoms. The person suffering from asthma complains difficult in breathing and wheezing. Okay, difficult in breathing and wheezing. Okay, wheezing means மூச்சு திணறல். Some of the common symptoms of asthma include coughing, especially at night, அதாவது இருமல், wheezing, shortness of breath and chest tightness, pain or pressure. Okay, you see the image. That's the symptoms of asthma. Next, causes. Asthma occurs due to inhalations of allergens. Okay, during respiration we inhale that oxygen. Okay, with the oxygen, that is the gas, okay, some of the allergens also go inside and cause the asthma. Okay, allergens such as dust particles, dust, mold. Okay, mold from the fungi. Okay, fungi spores. Okay, it's called mold. Air spray, air spray like the scent you are using, scent body spray. Okay, it is also caused due to allergen such as air pollution. Okay, the lot of vehicle, okay, produce a pollution. Drugs. Okay, drugs means we are using many medicines. Okay, some of the medicine is allergic to some persons. Drugs, cold air, smoking, fragrance. Okay, fragrance means smell. Okay, we get from the flowers or any other chemical substance. Okay, fragrance. Okay, these are the substance which cause the asthma. Next, prevention. How to prevent that asthma? Minimize the exposure to allergens. Minimize the exposure to allergens. Minimizing the exposure to all type of smokes. Avoid going to public place that permit smoking. Avoid coming in contact with the people suffering from cold. Always wash your hand thoroughly after touching the item that have been handled by other with respiratory disease. Okay, if the person suffering from the respiratory disease, you should avoid contact with them. Okay, get yourself vaccinated every year to protect against flu virus and pneumonia. Okay, vaccination. நம்ம நோய் வரதுக்கு முன்னாடியே என்ன பண்ணோம், நம்ம மருந்து எடுத்துக்கிறோம். ஓகே, அதான் வந்து வேக்சினேஷன். ஓகே, கெட் யுவர் செல்ஃப் வேக்சினேட்டட் எவ்ரி இயர் டு ப்ரொடக்ட் against a flu virus and pneumonia. Always take the medication as prescribed by the doctor. Okay, if you suffer from any disease, you should go to doctor. Okay, and then doctor give the prescription and then you buy medicine from the medical shop. Okay, without doctor prescription you don't buy any medicine in medical shop. Okay, that is very danger. Visit your doctor regularly to take your medication correctly along with the right amount of dose. Next, bronchitis. Okay, bronchitis is a Swelling of the lining of the bronchial tubes. Swelling. Swelling means weaken. This delicate lining covers and protects the respiratory system. Bronchial tubes are the airway that connect trachea to the lungs. Okay, trachea is also called windpipe. Okay, the bronchial tubes are the airway that connect the trachea to the lungs. The swelling of the linings make harder for the air to pass in and out of the lungs. Okay, the tube becomes swelling. Swelling means weaken. Okay, okay. After the swelling, it's hard for the air to pass in and the out of the lungs. It also makes the tissues more irritated. Okay, more irritated, and hence mucus is produced. Okay, mucus is some sali. Next, symptoms. Cough is most commonly seen in people suffering from bronchitis. Okay, cough means irrimal. Besides, there's a person suffering from bronchitis also complain headache, chills, mild fever, shortness of breath, wheezing, feeling of tightness in the chest. Those are symptoms of bronchitis. Next, causes. You see the image. The bronchitis is usually caused by virus. Virus can spread from one person to another by coughing. Viruses can be easily spread if you touch your eyes, nose, or mouth after coming in contact with the infected person. Smoking and exposure to air pollutant such as chemical fumes. Okay, chemical fume means that a chemical used to burn. Okay, create the fire. Okay, example வெடிமருந்து சொல்லலாம். Okay, வெடிமருந்து chemical fumes are also some other causes of bronchitis. Next, prevention. How to prevent from bronchitis disease? Wash your hand. Wash your hand to prevent the spread of germs. Avoid smoking. Okay, smoking is very dangerous. It creates cancer also. A non-smoker should avoid being around the smoker as think smoke is more susceptible to viral infection. It also increases congestion in the airway. Okay, congestion means நெருக்கடி. Okay, it also increases the congestion in the airway. Take plenty of rest. Eat healthy diet so that your body can fight against illness. Okay, you should eat healthy food. Next, pneumonia. Pneumonia is the inflammation of the lungs tissues. Inflammation means weaken. Inflammation is a localized condition in which the part of the body become red, swollen, hot and painful. Next, symptoms of pneumonia. The main symptoms of the pneumonia include cough, chest pain while breathing or coughing, fatigue, that means sore, okay, feeling so tired, fever, nausea, okay, nausea means kumattal, okay, vomit feeling இருந்துகிட்டே இருக்கும். Next, shortness of breath. These are the symptoms of the pneumonia. You see the image. Next, causes. Pneumonia is caused by germs. They include the bacteria, okay, mainly bacteria and virus. in the air we breathe. Okay, that only cause the pneumonia. Normally, the immune system in our body prevent the germs. Okay, normally we have the immune system. Okay, that is prevent the germs from the infecting the respiratory system. But sometimes the germs overpower the immune system. Okay, the germs themselves create that power that overpower the immune system. Next, prevention. Okay, flu is the common cause of pneumonia. Flu means சளி காய்ச்சல். Okay, flu is a common causes of pneumonia. We should wash our hand frequently, especially after going to the washroom and before eating. Okay, when we go to the washroom and before eating, we should wash our hand. Smoking reduces the immunity in our body by damaging the ability of lungs to fight against the infection. So, smokers are considered at a higher risk of pneumonia. Okay, not only pneumonia, okay, but also the corona and many other disease. Okay, the smoker, okay, if the person is smoking, easily is affected by many disease. Okay, smoking reduce the immune system in our body. A healthy diet, proper rest, regular exercise prevent you from getting ill from viruses and bacteria. Okay, healthy diet, rest and regular exercise is important. Next, tuberculosis. Tuberculosis is an infection disease that usually affect the lungs. It is a bacterial diseases which spread when a person suffering from tuberculosis sneezes na tumbal, cough, talks, laugh or split. Next, symptoms: coughing, fatigue, fever, chills, loss of weight, loss of appetite. Appetite means பசியின்மை. Sweating at night, வேர்வை. Okay, sweating at night, especially night, are a few symptoms of tuberculosis. Okay, you see the image. Next, causes. The bacterial infection passes from one person, okay, that is the infected persons, to another by the droplets. Okay, when they sneeze or cough, talk, that saliva, okay, the saliva, okay, you see the image, that saliva is sweat from the saliva and also the air. It occurs when someone suffering from tuberculosis infection through the sneeze, cough or talks. The tiny droplets of the mucus, okay, mucus means sali. The tiny droplets of mucus or saliva are passed into the air, which can be inspired or inhaled by another person. Next, prevention. Wearing a mask and covering the mouth at public places help in lessen the risk of transmission of disease. Okay, you should always wear a mask, okay, that avoid the lot of disease. Okay, that protect you from the lot of disease. Avoid spending time with anyone who is suffering from active tuberculosis in an enclosed and stuffy room. Also, the germs of tuberculosis spread in a small closed space. If the outside weather is not too cold, then switch on the fan. Okay, if the outside weather is not too cold, then switch on the fan or open the window to blow the inside air outside. I hope you understand my teaching. Thank you.